There's Kaylee. Oh no, where'd Kaylee go?
My children are everything to me. Being a parent is the greatest thing that this world has ever known.
Probably the thing that gets to me the most is just watching them play together and interact. And Jaden's so good and takes care of Kaylee, and she loves to torment him, but he's always good to her. Just watching them play and laugh.
Sorry to all you other parents out there, but ours are the best.
Mrs. Tullis has Rh disease. She has an incompatibility between her blood and the blood of her babies. With this, she has pretty complicated pregnancies where her babies become anemic in about the midpoint of pregnancy and require transfusion. This is usually accomplished by giving transfusions to the fetus into the umbilical cord in the middle of the pregnancy or in the latter part of the pregnancy.
We planned on going up, having the transfusion, turning around and coming back home, but instead we wound up having a baby staying there for 3 weeks.
We ended up having to miss mortgage payments, miss car payments, all that. Whereas if we were here in St. George at home, we've already got a roof over our head.
Most people understand the word ultrasound machine, but over the years this piece of equipment has become much more sophisticated.
We've put in for a new 2006 ultrasound machine that has color flow, Doppler, and 3D and 4D imaging, which is really the state of the art.
The color flow Doppler is our window to the womb. You see the oxygenated blood is red, you see the unoxygenated blood is blue.
It allows us to not only do the basics of measurement and anatomy survey, but to really examine and do a full physical exam on the baby before birth so that we can do things like check Mrs. Tullis's baby for anemia, to do the kind of studies that really should be done in a first-class maternal fetal medicine unit in 2006.
The one baby having one less artery, they had to end up doing 5 amnio reductions. But if they hadn't done the color Doppler, we would have never have known that. We would have never have known that she only had the one artery, and they wouldn't have watched me as closely as they did. If they wouldn't have caught it, either I could have died, or both of the babies could have died, or all of us could have died. But we went through a lot. It was a lot to deal with, just with the twin-to-twin, but all the medical stuff, all the doctors, the different doctors that we saw probably 15 different doctors. But the outcome was really good. 2 weeks later, of course, I gave birth, and I have 2 beautiful babies that are finally at home now after being in the hospital for 2 months.
You know, it just means the world to me to have them here, and to think of what could have happened to my wife and my daughters, and just, we are truly blessed.
Oh, it is a window to the womb, because whenever you have the ultrasound done, you can sometimes hear the baby's heartbeat, and with the color Doppler, it shows you just that much more, because you can see the blood flow going through your baby and hear the heartbeat at the same time, so you really see that it is a live little thing just moving around and living inside of you. It is a window to the womb.
10% of all the births in any hospital across the nation will have some problems, some complications, some more severe than others. So when you think about what does that do to healthcare costs, and is this a prudent thing for us to do? Should we just ship all these patients to Salt Lake City? Going by air transport is $10,000 charge. Separating families from one another is a huge expense. Having a NICU baby in a hospital away from their home, and if a baby's in a hospital for 2 or 3 months, just imagine what that is.
In order to provide the services here at Dixie Regional, we have been very grateful to our community for the donations and the support that they have provided us. We would not be able to do this without the community support.
So it's such a great opportunity for each one of us to give something special to our future. And this program will need an extra hand from the community, and I'm hopeful that our community will respond in the way they've always responded.
My babies are doing really good now, and what I'm most thankful for is that they are doing okay and they're healthy and they're living and they're here with me.
For anyone who donates, thank you for bringing these services home to this area and giving opportunity to other families like ours.
It's a life or death situation if you don't have it. It really is.